We have special guests from the hospital that I would like to acknowledge, but before I do so, I'd like to take a quick moment to thank Sumner Peck Ranch for hosting us this year and donating all the wine. So thank you so much. Todd, we appreciate and thank you for all your personal time and resources that you give to the guilds, and we thank you for being with us here today. I'd also like to recognize Noreen Wade, Chair of the Guild Coordinating Council, Allison Karahardian, Vice Chair of the Guild Coordinating Council, Nancy Masich, Advisory Board Chair, Rob Soroyan, Chief Development Officer, Vice President of Philanthropy at Valley Children's. The guilds are looking forward to supporting your areas with $2 million towards the Heart Center, $1 million towards child life, and $1 million towards spiritual care. So before lunch is served, I would like to give a big shout out to Wahoo's Fish Tacos and Cold Stone Creamery, owned and operated by a local family. So as a guild whose signature event started off with restaurant takeovers, we wanted to carry that theme out to today's picnic. So we brought a takeover to you of a locally owned restaurant. So Wahoo's Fish Tacos is a friend of Valley Children's. And like many of you, they have a special story. So I would like to take this time to invite Julie, owner and operator of Wahoo's Fish Tacos, to come up and share her story.
On Thanksgiving Day 2008, as I was visiting with family, I suddenly realized I was going into labor. I was 27 weeks pregnant. I panicked. This was my second child, and I knew it was way too soon to have my baby. I had an infection which caused my water to break and preterm labor to start. There was no stopping it. Jane was on her way. When she was born, the team from Valley Children's Hospital immediately went to work, and I will be forever grateful to them for getting my baby breathing and working so quickly to give her the best chance at life she could have. She was 2 pounds, 4 ounces, and 12 inches long. Jane would spend the next 2 months at Valley Children's in the neonatal unit. The entire staff, doctors, nurses, administration, volunteers were amazing. On her 4th day of life, Jane had to have a PDA ligation surgery. I sat and prayed. It was all I could do. I couldn't imagine how they would operate on a teeny tiny heart. Since her first 2 months stay, Jane has been back to Valley Children's many, many times. She was hospitalized twice for pneumonia. She had another surgery, this time on her skull at a year old. And we still continue to see Dr. Simbre for her heart checkups. For Jane, Valley Children's is like home. She knows when she gets sick, she will be well cared for and always nursed back to health. It's not just the doctors and nurses, it's the facilities, the play areas, the social workers, the volunteers that make the stay at Children's so comfortable and not so scary. Jane is my Thanksgiving baby. I will always give thanks for the care she received and the miracle that she is. I learned firsthand how critical quality medical care is to a community. Recently, Jane had to have a procedure at Stanford's Lucille Packard Children's Hospital. The doctors at Stanford told us how fortunate we are to live in Fresno and have Valley Children's so close for Jane's care. Valley Children's would not have such an esteemed reputation without the tireless work of its guilds. The fundraising provided by the guilds enhances the levels of services provided by the hospital. When we lost my father suddenly in 2011, we asked that donations be made in his name to Valley Children's because our entire family was so grateful for the care we received. Our friends and family were very generous because they know how important Valley Children's was to our family and to all our families here in the Valley. Thank you for allowing me to share my story. Enjoy your lunch.
And Julie, thank you for sharing your story. I know it will be held in the hearts of our guild members throughout the year as we continue to serve Valley Children's Hospital and its mission. I would like to introduce Rob Soroyan. Just over a year ago, I had the pleasure of meeting Rob as our new Chief Development Officer and Vice President of Philanthropy. Over the past 12 months, we have witnessed vast experience that Rob brought to Valley Children's Hospital and his ability as a solid fundraising team and engaged in our local community in philanthropy. Rob has spent time getting to know the guilds and has attended many of our events and meetings. And Rob, we thank you for your time.
Thank you.
Good afternoon. What a beautiful, glorious day. Just what the guilds really wished for. So it's really neat to be here, and a special and echoing what Noreen just mentioned. Special thank you to Visionaria Guild for hosting a wonderful event. Speaking of Visionaria, how about their vision to honor one of the founding mothers and true pioneer, Mrs. Carolyn Peck, by having this wonderful all-guilds picnic at Sumner Peck Ranch. Gorgeous. You know, great institutions are formed by establishing a strong foundation. Over 60 years ago, the beginnings of a great institution devoted to caring for children began its remarkable journey. Powered by the tireless philanthropic efforts of the guilds, Valley Children's Hospitals today ranks among the best in the nation because of you. Our CEO, Todd Centerpack, his vision for Valley Children's is bold and inspiring. As we grow throughout the Valley and create more access for families, and that's a big, big goal of ours, we have a golden opportunity to work together with you, all the guilds, the most loyal, dependable partner anyone could ever be blessed with. So thank you very much. Enjoy your day. We look forward to working with you in the coming year.
We're going to thank Rob for his great work, and we look forward to continuing to build a team together to expand philanthropy throughout the Central Valley. At this time, I would like to invite Todd Centerpack, our President and CEO at Valley Children's Hospital, to the stage. Before I present the Guild's 2014 fundraising check to Todd and Rob, I'd like to take a moment to thank each of you, our guilds, for your time and continued dedication in helping to further the mission of Valley Children's Hospital and the 1.3 million children we serve. In 2014, the guilds completed their $5 million pledge towards the Guild's Child Abuse Prevention and Treatment Endowment. This check that I'm about to hand over to Todd reflects the completion of the pledge and the beginning of the new $4 million goal. Each year, you, our guilds, raise more funds than the previous year. In 2014, the guilds continued down that pattern and broke another all-time record. It's with great honor that I present this check of $927,353 to Todd and Valley Children's Hospital. I'd like to keep Rob and Todd up on the stage. We have one more presentation. Todd, before I ask you for your remarks, we have one more check to give you. For the past several years, the guilds have convened an all-guild committee fundraising group as a way not only to raise additional funds for the Valley Children's Hospital, but also to be able to connect with fellow guild members. In the fall of 2014, we were approached with new partnership and fundraising opportunity. World Ag Expo and Toyota approached the foundation and asked if Valley Children's would be interested in partnering with their annual Toyota Tundra drawing at the World Ag Expo. The foundation team immediately thought of the guilds, and within an extremely short period of time, a committee was put together and the guilds got to work. I'd like to invite Kelsey, I know I'm going to mispronounce your last name, Kershaw, Chair of the 2015 and 16 All Guild Fundraising Committee, to come up and introduce her special friends. You ready?
Thank you, Noreen. First and foremost, I would like to thank you, the Guild members. Whether it was joining the committee, pre-selling raffle tickets, or working during the 3 days of the expo, this wouldn't have happened without you. As Noreen mentioned, this event was put together very quickly. In a matter of weeks, the coordinating council approved the fundraiser, and we were printing raffle tickets. Not to mention it was right in the middle of the holiday season. To me, this is the epitome of the guilds. If we are given the opportunity to support and raise funds for Valley Children's Hospital, there's no excuses. We will succeed. Of course, none of this would have been possible without our partners at World Ag Expo and Toyota. I would like to invite our new friends to join me at the podium. Jerry Siniff, CEO of the International Agri Center, Alan Klee, 2015 Chair of the World Ag Expo, Marty Mayforth with Madera Toyota, and the winner of the 2015 Toyota Tundra, Oscar Gonzalez.
Thank you. You know, it was about a year ago that we got together with the marketing team at Valley Children's and said, one of those what if kind of meetings. We said, what if we could make the Toyota Tundra giveaway a fundraiser for Valley Children's? We knew we had some challenges with the name change. It was close, but you all made that happen. It's an incredible thing that happened. So I want to thank you most of all for selling the tickets, actually, and making that all possible. Wanted to thank the Northern California Toyota Dealership Association, which Marty leads that team. Thank them for providing the vehicle for World Ag Expo. And Oscar, one lucky dude. But mostly thank you for the opportunity. We are looking forward to next year. It's going to be a great year. We get started early. There's no reason why we couldn't raise at least $100,000. Thank you.
Good afternoon, everybody. I always enjoy the Guild picnic as one of the best days of my year for a number of reasons. First reason, I get to be amongst the guilds, which I've gotten to know more and more of you, and I can never fully express my appreciation for everything that you do. And I know for many guild members, it's a family affair across generations, and spouses and cousins and brothers and sisters get dragged into the events. And so my heartfelt thanks to all of you and your families for supporting the health and well-being of children. It's not lost on me any day of the year exactly how important the guilds are to Valley Children's today, or how important the guilds were to Valley Children's over 6 decades ago. We would not be here without our guilds. So please all take a round of applause for each other. You are phenomenal people. One of the other reasons I like being with you at the picnic every year is I get money to help kids with. And so I want to recognize those contributions, both of our guilds and also new friends that joined us today. And the third and last reason, before I follow the instruction that Teresa gave me earlier this morning about my remarks, is to say that it's a particularly special day for me to be here at Sumner Peck as Valley Children's once again. And as Carolyn and I chatted the day before the announcement of the name change came out, we both agreed it always should have been Valley Children's. So it's great to be here today. So now I'd like to take a few minutes and just describe to you, I know we've spent a lot of time together talking about the new commitment and the 3 areas that the commitment will support, but I want to fill in some of the blanks, if you will, about what Valley Children's is doing around the central part of our state that you may not see yet, but that is either in the works or we've already taken the action. And notably, January 1st of this year, we acquired through our medical foundation, Valley Children's Medical Group, our first primary care practice in Bakersfield, San Dimas Pediatrics. Within the next few weeks here, I'm looking at Michelle to see, I'm trying to get my timelines straight. Within the next few weeks here, we will complete our second pediatrics practice in Bakersfield. I can't disclose the name yet, but you'll start to see more and more of Valley Children's, whether it's the foundation, the medical foundation, or some of our other enterprises around the valley, focused on enhancing access to pediatric care for kids, and not just specialty or subspecialty care anymore, but actual pediatricians in the community. Through our partnership with Adventist, we currently are supplying them, the Adventist Health System, with 4 pediatricians. They've asked us to recruit a number more, that's somewhere around 10. And so the small communities that Adventist serve in the south part of our valley, in some cases will have a pediatrician in their town for the first time, ever. Those same discussions are occurring up and down the valley. So they're occurring in Kings County, in Fresno County, Merced County, Stanislaus County, clear up to San Joaquin County. And I'm excited to be able to come back to you next year and tell you all of the results of the hard work of the team at Valley Children's and how we're helping kids. And I didn't mean to leave out Tulare County, but that's a whole different discussion. There's quite a lot going on there, but no matter what county in the Central Valley, Valley Children's will be focused on enhancing care from pediatrics, in some case from perinatal care with perinatologists for high-risk moms, all the way through pediatric specialty care. And we'll be investing in the next decade in a way that you've not seen in quite some time by Valley Children's, probably since we created the replacement facility in Madera. So more to follow. It's a very exciting time. To give you an idea of how many pediatricians we'll be recruiting this year, it's somewhere between 25 and 30 that will not be in Madera. They'll be up and down the valley, and that's probably the starting number. So some really exciting stuff to come that'll help kids stay well and improve the health and well-being of kids. When I mentioned what we still call the new hospital, even though we've been there since 1998, there's something very exciting that is coming up I want to share with you in advance of my PR team, so I'm going to hear about this later. And I'm not sure about the exact day yet, so stay tuned, and we'll make sure that we ask Teresa to send out the information in advance. But sometime in the very near future, we will see the day where we see our 1 millionth child in our ER. That's not even counting our clinics or the hospital. 1 million kids in our new ER. Just think about that for a minute. And we would not have been able to do that without our guilds. So please know that you're playing a vital role in everything we do every day. And again, my deep gratitude and appreciation, and thanks again. And great party. La Visionaria Guild, great job today. Thanks.